Good evening, everyone, and welcome back to Revolutionary Health. Revolutionary Health is a program of the Counter Narrative Project, and the mission of the Counter Narrative Project is to build power among Black gay men and to work in coalition and solidarity with all movements committed to racial and social justice. You can find us online. You can certainly visit us on Facebook. We're at the Counter Narrative Project. On Instagram, we're at the Counter Narrative. And on Twitter, we're at Building Desire. If you visit our website, thecounternarrative.org, make sure that you join our mailing list so you can stay in touch with all things Counter Narrative Project. You are joining us here on YouTube, so make sure, if you haven't done so, hit the subscribe button as well as the thumbs up button to let folks know that you are enjoying the show. I am Johnny Cornegay. I have the pleasure of being Mobilization Director for the Counter Narrative Project, and I'm joined by...
My name is David Malebranche. I am a local physician and academic in Atlanta. And I am representing Veni Etienne today.
Shout out Veni.
Stock Passe Haitian. If you watch Project Runway this season, Veni was one of the brothers who made it to the final six, and they had a project where they had to develop a shirt with kind of a logo on it, or what they wanted to represent. And this one is I Have a Name. And if you're interested in getting this t-shirt and supporting Veni, there's a website called ninethamendment.com. NINTHAMENDMENT, ninethamendment.com, where you can get it. And then also, Veni has his own clothing line that he's done. He works Lavinity.com.
Yeah.
So support our brother,
Please.
Veni Etienne. And I just want to represent, because I ordered the t-shirt near the end of Project Runway, and it just came yesterday, so I'm very happy to support him. And next week, I'm going to support my baby Bishmi.
Okay.
Because I have a crush on him. Trevante Rhodes has been kind of bumped to the side. So, Trevante, I'm sorry, but I've moved on. So it's all about Bishmi right now.
And he's on Project Runway too.
He was, yeah. He made it to the Final Four. And so he doesn't know we're going to get married.
Yeah.
Well, I think he knows now.
Okay. He may know. Okay, go ahead.
So I'm really happy to be here. My name is Machel Hunt. I am a psychologist, specialized in relationship counseling and psychosexual therapist. I'm also the assistant director of clinical programs for Emory University Hope Clinic. And I'm really happy to be here. Really engaged in Atlanta local community. I'm from London, but I've been living here for 2.5 years now, and just really enjoyed the work and doing the work within the community, and just happy to be here with you guys today.
The Southern accent has already kicked in.
Right.
You can tell.
Just a little bit.
You've
Right?
got it right.
Just a little bit.
Listen, thank you so much for joining us, and to everyone who is watching. And I see that there's a lot of you. We love you for it. Make sure there is a chat window on your screen. Make sure that you send your comments, send us shout outs. We will do our best to make sure that we get to them throughout this conversation. And we're going to have, it's a continuation of some conversations that we've been having on Revolutionary Health. And today we're going to talk about PrEP, specifically PrEP and research today, right? So, bit of a story time. So as we get into this conversation, I have sat in many rooms, had many meetings with folks, and when the discussion of PrEP comes up, there is a combination of reactions that still happens, right? We've been having this dialogue for a long time.
Right.
But what I know for sure is that within the community, there's still a lot of questions, there's still a lot of information that people don't have. So as we come into this, I'm just excited to keep learning new stuff because it always comes up. And hey, John Jordan, I see that you joined us. So I want to open up here. Let's talk about, and I know we do this and we've done it before, but let's do it again here. What is PrEP? Let's let the people know.
What is PrEP? So PrEP is short for pre-exposure prophylaxis. And what that means is for someone who's HIV negative, they can take precautions, biomedical precautions, we call it a pill right now. They can take every single day that will prevent them from becoming positive if they're exposed. So right now it's a pill a day. In the future, it might be something different. So we're actually, in my clinic, we're actually experimenting with new drugs that will be infused. So You can take an injection every 8 weeks, and we'll do the same thing that the pill does one a day. And right now we're in a very exciting time because PrEP is more widely available now than it's ever been since it came out in 2013. So yeah, I think just being aware of what that actually means, PrEP, and it's part of a holistic kind of engagement for people who are HIV negative. So it's the pill and condoms, and kind of negotiating with partners about what their status is.
Yeah, I think the point is a good one that Michelle made, is that it's not just a pill. So it's, people look at it as, I have to take a pill a day. And no, it's kind of like a comprehensive set of services about sexual health. So think of it as an option for HIV prevention. And obviously it's not for everybody. There's some people that prefer just to use condoms or prefer not to use anything at all or have other ways to prevent HIV. But it is an option that you can use. And so what we know right now is that there's been one medication called Truvada that's been FDA approved for it. And it is widely available, and this is the one you've heard in the news a lot. They had hearings on Washington, D.C. because the accusations of the Gilead company that makes Truvada, gouging the prices in the United States versus Australia, and then the potential side effects. You'll see a lot of things. I've seen a lot of stuff on social media recently about side effects that, to be quite honest with you, are absolutely, some of them are absolutely false.
Can we talk about that? Because that has actually been, I've seen sponsored posts that have been coming up. And I do want to talk about that a bit. So can we talk about what we know about side effects and what the truth of that science is?
So I think just to say firstly, almost every single drug will have some side effect. Those side effects may not impact every single person that takes it, but there are side effects. If you look at every drug, aspirin, painkillers, Tylenol, everything will have some side effects, because when these drugs are being patented, they have to consider every single instance that may have happened in that period. So to go first, and you can talk a little bit more about this as well. But so the side effects mostly are very short-lived for PrEP. So you'll have nausea, diarrhea perhaps, headache, feeling of bloatedness, but those usually dissipate after a few weeks. So that's the main thing about PrEP, is that even if you do experience some side effects, which most people don't, it won't last long. So there's a difference between side effects and long-term implications of drugs. And I think that's something that people often get confused about. What is a side effect? Something that happens with every single drug. Long-term implications, we don't actually know what those long-term implications are for people who are HIV negative, because the drug's only been around in being used in this form since 2013. So there's still no history of research to say what the long-term implications are. But based on research that's been done prior to the drug being prescribed as PrEP, we know that kind of bone density can be impacted, and your kidney functioning can be impacted, because the kidney processes almost everything that we ingest. So adding something else for that to be processed is gonna put some strain on there. But that's why we monitor that. Every 3 months you get your kidney function test, and we can see if there's a change in how that's being processed, and then we can treat that accordingly.
Yeah, I always use the word potential with this, because there's always the potential for side effects. My experience, I've prescribed Truvada as a medication for people living with HIV since 2004. I've only done it for people who are HIV negative for PrEP since 2012. I think it was like August 2012 it was FDA approved. And so I can tell you from experience that I didn't see a lot of kidney and bone complications in the patients that I had who were living with HIV. And this is, some of the folks that I took care of had a lot of other comorbidities like high blood pressure, diabetes, things that can affect the kidney, and I didn't even see them among them. So if you see somebody who's HIV negative and may not have other comorbidities or other medical problems, I haven't seen that at all. And so like Michelle was saying, the kidney problems are something that's brought about, but even that's ridiculously low, like less than 1% in a lot of the studies that I've seen. The bone implications are reversible if there's some slight change in the bone density that you see. But again, it's one of those things where you can get a lot of this stuff from other medications too. So the point is that Truvada is relatively safe. And so look at it with a critical eye when you see these sponsored programs coming down your timeline in social media, and when you hear these things from other people that are saying stuff. I can say the one thing that I do see, and that the only reason that I've had to stop somebody who was on pre-exposure prophylaxis on Truvada was because they were working out. I think we did this on the show before.
Yes.
But like somebody who's working out and who's not testosterone, but like amino acids, creatine, and heavy doses of protein, whey protein, that flood the kidneys with protein. And then if the medication is kind of working with that, then you can have some damage to the kidneys and the tubules in particular that kind of filter proteins, that filter other kind of substances, and that's where the damage can happen. That's the only time I've had it. Otherwise, like with the side effects that Michelle says, the only thing I've seen is maybe some mild nausea or bloating. Most of the people that I start on Truvada for PrEP have no side effects whatsoever, because I'll check it with them 2 months and I'll be like, so how did it feel? Did you feel any different? Do you have any problem? They're like, nah, it was like a vitamin. I was fine. So be wary of when you hear these horror stories or when people automatically go negative with it. It's like with any medication. Someone can tell you, I have high blood pressure and I took this blood pressure medication and it made me feel like this. And you shouldn't look at it and say, well, oh my God, I can never take that blood pressure medication. If that one is the best for you and your body processes things differently, consider it. But I think a lot of times we listen to these stories in the community. If someone says
sensationalized,
it's sensationalized. Somebody says, yeah, I had a really bad experience with that, and then you're like, well, it doesn't work for anybody.
And I guess as well, Truvada is a new drug as far as treating people who don't have an illness. You know, it's been around for a really long time, but it's always been associated with HIV treatment. So now it's a brand new drug, and I think the one thing I will say is that if you think about what Truvada does as PrEP, it outweighs any of the issues that you're going to get. If you compare what happens with Truvada potentially, as opposed to what you have to deal with if you are HIV positive and then have to deal with antiretrovirals for the rest of your life.
Yeah, don't get caught up in the potential side effects when you're thinking of what it's actually a potential disease that it's preventing you from getting, that we know it's over 90% effective in preventing you from happening.
Absolutely. So I mean, when I see patients or when I see clients, I always say to them, think about the risk reduction. Think about what you're actually avoiding, even with the potential side effects. You know, you go through the list of side effects. These might never affect you. You know, but if you are HIV positive, chances are you'll get a lot more implications from the drugs that you'll be taking.
Thank you so much. That's like really an important point, and I want to bring in some comments from some of the folks. First of all, Dr. Q is joining us. Dr. Q just
Dr.
checked
Q.
in.
Hey,
Dr. Quentin, thank you so much for joining us. We have JC who said, hey fellas, sorry I'm late. Thank you for sharing and enlightening the community. So I want to thank you both for that. I'm going to bring in this question because we've kind of addressed this in a previous show, but I think this still comes up. Not your theme today, guys, but there are HIV positive, but let me see. So this is a question. I'm gonna phrase this question differently. So this person is asking a question about individuals who may say on an app that they are using PrEP, but really are individuals living with HIV. And is that misleading?
That's a real thing. So, and I know you're going to speak on this as well. But so in the apps like Grindr and Jacked, what does happen sometimes is that there are some people out there who are HIV positive who will say that they're negative and on PrEP, but they're actually living with HIV and taking a full arsenal of, you know, antiretroviral medications. Now, what's interesting about this is that, yes, that's duplicitous. There's absolutely no doubt about that. And so you have to go into these situations with a skeptical eye and have conversations with people, honest conversations, because Truvada is not only used for pre-exposure prophylaxis if you're negative, but it's also a foundation combination medication in antiretroviral therapy. The thing is interesting to me is that if someone is HIV positive and on antiretroviral therapy and they're undetectable, then the risk to you is essentially zero.
Right.
And so it's actually one of those things where, like, this is a fact from like thousands and thousands and thousands. But the problem is that it's kind of like the problem with being deceived with that,
Right.
and that is a real thing, and I don't know if there's a way to control that or whatever. People are going to do what they want to do because they're not comfortable
Right.
disclosing that they're living with HIV because of criminalization laws, because of rejection, because of HIV stigma.
Right.
And so you have to go into these situations with a little bit of understanding about why someone may want to
Yes.
do that.
And I think that's a great point. I kept jumping in because I wanted to.
You wanted to say, right? I'm sorry.
So I think the problem with that is stigma. of
It still
course.
goes
Yeah.
stigma.
There is
Right.
so much stigma still about being HIV positive,
Right.
and I think it takes a lot for someone, particularly online,
Mm-hmm.
to admit that they're HIV positive to a group of people that may or may not reject them.
Right.
It's the same reason people use other people's pictures online.
Mm.
It's the same reason someone say they're 6'1"
Mm-hmm.
and 180 pounds when they're really 5'8"
Mm-hmm.
and 250.
Right,
Yeah.
right.
So
right.
it's no different from that. I think someone like you said, if you're HIV positive, on medication, undetectable, then you're as good as being on PrEP,
Better.
or as good, or better, or
I mean,
as
quite
good
as
as
good.
being negative.
Right. Right.
So I think that's not something that you really have to lie about. But when the stigma comes in and self-esteem and confidence and value system and worth comes into it, then people lie about all kinds of things.
Yeah.
And unfortunately, we live in 2019 now where PrEP is on one hand glamorized. It's like, I'm on PrEP, it's fine, it's great. Like, I can have HIV, have sex with people who are HIV positive or negative, and it's okay. So that kind of glamorization of it makes it more attractive for people to say, I'm on PrEP, as opposed to saying, I'm HIV positive and I'm undetectable. Because that's not so sexy.
And I think that message has to be brought along too.
Right.
Is that when you actually look at the studies, and I do speaking for Gilead. I'm part of doing presentation for PrEP to medical providers to educate them about it being an option. And the studies that were done by Gilead that makes Truvada showed effectiveness that was greater than 90%, but it wasn't 100%.
Right.
When you look at treatment as prevention, people who are living with HIV,
Yes.
on their medication, undetectable, that shit is 100%.
Yes.
Right.
That shit is zero transmissions.
Yeah.
There's still transmissions with Truvada's PrEP. And then also, the point we could also make is that the two are not mutually exclusive. So again, Michelle mentioned something about the decisional balance. Whoever's out there listening to this, you have to figure out what's best for your sexual health.
Right.
So for some people, if you're HIV negative and you're dealing with someone who's HIV positive, you may be comfortable with having sex without a condom if they're undetectable. You may be a person, on the other hand, who's not comfortable with them being just undetectable,
Right.
and you may want to try PrEP in addition to them being undetectable
Right.
on their medications. The joy of this is that you have options, and
right.
you get to combine them as you wish.
Right.
To make it better for your sexual health, and you get to do what you feel comfortable. And as Michelle said, it's a decisional balance. If you're like scared of these side effects and or potential side effects, and you're worried about potential side effects, and that shit scares you more than contracting HIV itself, that's where you have to make your decision.
Right.
And everybody's comfortable with a different level of risk. It's kind of like when I educate people on having oral sex, top, bottom, condoms,
Right.
no condoms. If you're having oral sex without condoms, you must be comfortable with the risk of getting herpes, syphilis, chlamydia, and
Right.
gonorrhea. You have to be comfortable with that, and you can't be surprised when you get it. But HIV is going to be low risk with oral sex, if not zero risk with oral sex. So you have to decide what's best for you, and everyone's a little bit different.
I think
some people are
everyone's
comfortable
different.
with certain things, some
And the
people
thing
aren't.
is the thing is people will be comfortable if they feel like they trust someone.
Right.
And I think that's where a lot of the people I see, particularly in this year, who become positive, have become positive because they trusted the
someone.
partner they were with. And they said, I would have never done that if it was someone I met online. I would have never done that if I met him, in the back room of somewhere. But because we were together and we had this romantic relationships and we went on dates.
Or I knew him for a long
I
time.
knew him for a long time.
Right.
So then you let your guard down. And I think oftentimes, just going back to this question, it's about you have to be in control of your own sexual health. I approach every single person I have sex with as if they are HIV positive, or as if they have herpes, as if they have some kind of infection that could be transmissible. And if you do that, then you protect yourself. It doesn't matter what they say. It doesn't matter how they present themselves. It's, if you're positive, great. If you're not, great. but I'm gonna do this for me.
Right. Right.
You know, and I think that's where a lot
That's
of
a great
people
point.
do not
That's a great point.
make good decisions because they're relying on the other person to tell them the truth, or relying on the other person to be trustworthy.
Right.
And you let your guard down, and then
Right.
you get into these situations where you're now having to navigate what you do now that you've become positive, or even if it's not HIV, some other
Herpes.
STI that you have
Right.
to deal with.
Right.
So yeah.
I think what is, and I'm going to bring in a couple of more comments,
Sure,
but
sure.
I think what's also, what's coming up for me as we're having this discussion is making sure that for all of us that we understand, so for all of the folks that are watching this particular show, teaching, and at some point teaching about what agency we have. So
Right.
one of the things that we just finished the film. This is one of the things that came up in the film is we are able, if you grow up in an environment where you feel like you don't have the ability to make certain decisions for yourself and are also looking for love because
And validation.
and validation and connection
Right.
and all of these things, it can impact some of the decisions that we
Absolutely.
make for ourselves, right?
I think that's where we go wrong. In particular, like a lot of people, you know, in the public health community, why aren't black gay men or black MSM like utilizing PrEP? And I think if we approached it from more of a social, contextual, emotional, psychological prospect like that, and looked at kind of we talk about intersectionality a lot.
All the time.
We talk about intersectionality about
we talk about it, but I don't think it's implemented the way it should be.
It's not implemented the
Yeah.
way it should be. Like if we talked about the impact of racism and microaggressions, if we talked about the impact of sexual prejudice or what people call homophobia, and how that isolates us and how that keeps us separate and how we're longing for some kind of connection, and then how connection actually means having sex without a condom.
Oh, absolutely.
And how what that means and the kind
Right.
of social and romantic and intimate implications that has, then we can talk about how to fit PrEP and their
Into
comprehensive services
that.
into that. But instead, we're starting with a pill.
Right.
And the fact of the matter is we don't trust the medical profession. And I'm sitting here as a doctor,
Right.
and I look at colleagues of mine. We were just talking about this before. There are colleagues of mine that I wouldn't send. I think Michelle said I wouldn't send my dog to
No,
certain
absolutely,
medical
yeah.
providers, and that's unfortunate to say. But there are a lot of medical providers that are really incompetent
Yeah.
and really don't have a lot of cultural humility. And so, if you start with the medication and work backwards, you're missing it. And
Right.
for us,
We
it's
have
all about the connection.
You're
What is the
missing the
P?
mark.
You're missing the mark.
The
And
P you
what-
asked with the pleasure.
Yeah, the 6P is pleasure. It
Oh
should be
yeah, pleasure is always. I mean, most people, 99% of humans have sex because it's pleasurable.
because it feels
You
good.
know, it
Right.
feels good. It makes us feel good. But I think one of the things that David you said, which really struck me, was this idea that we're starting with a pill, and you're moving backwards. You're taking the humanity out of it. And I've sat in rooms with medical providers who've been doing this for 15, 20, 50 years. And you know, a patient will say to them, "Would you take PrEP?" And they say, "No, I wouldn't." And then the patient says, "Well, why not?" "Because I'm not high risk like you are."
Ooh, that is.
And
hurt.
And that's the problem.
That's
And
the
that's the
problem.
problem.
So then you see this person, black, male, homosexual, probably not entirely comfortable with his sexuality.
Right.
And someone who is in a position of
No
power,
power.
whether you like it or not, you being the medical provider, you already have some level of power. To say that, I wouldn't use it,
Right.
but you should.
You should.
Because
It's
I'm
fucked
not
up.
at risk.
Right.
It completely changes any kind
Right.
of psyche that person may
Right.
have.
Right.
Instead of taking the time to say, explain, expand. You know, this is part of your holistic health.
Right.
This is something that's going to help you to flourish, to enjoy sex, to be great, and to explore without having the worry of HIV. They don't say that. They don't take the opportunity to do that.
Yeah,
I
the
think
message is more, what's wrong with you? You're
Right.
risky. So
Oh.
therefore you need it. I'm not risky,
Right.
so I don't need it. But then if you were to ask that doctor or physician, do you have
a condom
sex
with your wife.
With your wife, they say no. They
course
say
not.
no. So
Of
yeah,
course
that's a place.
not.
So technically they're at risk as well.
Yeah, of
I'm
course
actually,
they are.
I'm going to bring in some comments,
Yeah.
and then
I'm
I
sure
do
we have
want to
loads
circle.
of
We
those.
do. Thank you so much for this. So, Kanga311 said, "Thank you for clarifying the difference between side effects and possible long-term adverse
Right.
functions."
You're so welcome.
George said, "I think the side effects and stigma attached to the drug bring light to a major issue in our community. We should go to the doctor and check on our health always. And you should also always consult your doctor before taking any new drugs." Ennis, who asked the question that we ended up asking about the online, about the
Right.
apps, he said, "Thank you. I agree with the response. Thank you so much."
Okay, good.
Thank you, Ennis, for your question. Great
And let me see here. We actually have a question that has come in. Oh, let me do this.
Okay.
Kanga311 said, "Having more options and access
Yeah.
allows people to have greater agency over their sexual health." I want to come back to that, but I want to answer this question that Walter posed. Hey, Walter, thanks for joining us. And Walter said, "I'm sorry I came into the discussion late. I just got home. I did have a question. Is it possible to contract syphilis or other STIs from an HIV positive individual and not contract HIV?"
Yes.
Absolutely.
Okay.
Yeah, absolutely. Syphilis is skin to skin, so
Right.
it's much easier to contract.
And
than HIV.
bacterial infections are so much easier to transmit than viral infections.
Perfect.
So you could be having sex with someone who's HIV positive for years and
Never
not try
get
and
HIV.
not get HIV from them. And you know what I've learned about HIV is that it's a very intricate virus.
Absolutely.
And you can be exposed to it and not get infected. And you can get exposed to, depending on how much of it is in the virus at that particular time.
Absolutely.
Depending on what's going on with a person who's on the receiving end at that point. So there's no clear definition of when you are going to be infected. We know there's some routes and methods that will make you more liable to contract it, but there's no guarantee. So bacterial infections, however, are much easier to transmit. So yes, you can get everything but HIV, or you can get nothing except HIV. So it really is about protecting yourself at all times. And there's some bacterial infections that you can't protect from unless you're abstinent.
Yeah.
So herpes, for example, even if you're using a condoms,
You can still get it.
can still get it because it's skin to skin. Syphilis is another one. Some other bacterial infections like chlamydia, gonorrhea, you can get that from fingering someone and then sucking your finger afterwards, or fingering yourself and then using the same finger to finger someone else.
Eating somebody's ass.
Eating ass, all of those things can transmit bacterial infections. So what I would always say to people is, if you're sexually active, whether with or without a condoms, you need to get regular STI testing. Just do it because it's healthy. And in that way, you get to build a rapport with your medical provider. You get to talk to them. You become more comfortable. They become more comfortable with you, as opposed to going once every 2 years and they're like,
Right.
I don't really know how to ask you.
That's huge because
this right now.
that's a huge point, because PrEP is a comprehensive service, especially if
Right.
you're younger. Like a lot of times we tell people, especially men, you don't have to go to the doctor until you're like 30 or over 30. Like there's really like laxity in the recommendations for men, but look at it this way. PrEP is kind of one of those comprehensive services where you can start getting experienced in navigating the healthcare system.
Right.
You can get your STI checks every 3 to 6 months. You can make sure you're doing okay. And so by the time you get to be 40, 50, and you have to worry about other things,
Right.
you've already known how to do this. You already have a relationship with medical systems and providers, and you know what to do. So look at it that way, instead of like waiting until you're like 35, 40, and then deciding to go in and it's a whole new world that you have no idea how to navigate. Like that's one of the benefits of this to me.
Absolutely. And I think just, on the topic, we're all black men here. I think it's very important that black men feel empowered to take care of their sexual health
Absolutely.
and their mental health and their well-being. I think we've been taught through history that we're not valuable enough. We're not worth it. It's okay if you don't go to the doctor, it's
Right.
okay. But then we also get taught that wearing the nicest shoes is good, or dressing up is good. So now we're conditioned into making our external look great, but we're not really conditioned into thinking about how our health and well-being, mental health in that is being taken care of. So I would really encourage people to be more, in tune with what's going on with their bodies inside,
I'm actually going to bring in, so there's a couple things. I want to circle back around, so I want to take a couple extra minutes before we end because I want to make sure that I highlight something.
Right.
So Brian, thank you so much, Brian, for this question. I want to say what the question is because I want to acknowledge it, but I think we've already talked about this piece. But hi all, and he says special shout out to Dr. David, hope you're well. I've also seen IG ads about the Gilead lawsuits and PrEP. Can y'all speak to that a bit? We did talk about that coming up earlier in the show.
Yeah, I would just say what I do with them, because I've seen them on Facebook and Instagram, I actually report them because they're fear-based. And so it's the same thing as if, did you have a vaginal mesh, and did you this, have you been on this and that? They're just lawyers trying to make money off fear-based profit. And so just kind of ignore that and read some of the articles on the CDC or other kinds of reputable websites that will give you the practical information instead of just panicking, looking at it and say, are you having bad bones? So, just kind of scroll past those. You have to look at them with a more critical eye.
Thank you so much. And so what I want to do as we head out of the show is talk about, Michelle, earlier you talked about some of the things that are kind of coming down the pipeline. So I want to circle back just so that the folks know.
We haven't talked much about research today.
Yeah, I know. But what we've done, and thank you all so much for being so engaged with us, because this is what's important about this show, right? We get to talk about the stuff. This is what's coming up.
But that shows you where we have to go with this, and where the important part of it is. Like, it's not just the medication or the research that people want to hear about. It's about our lives, and it's about our livelihood.
Interaction.
Yeah,
I think so many. Having worked in research for such a long time, and then also being a practitioner, mental health practitioner, I get to see both sides of the coin. And my hope is that research just becomes more human-based. I really think that when I'm sitting with the researchers at the clinic, everything's always so what's going on with this vaccine? What's going on with this vaccines? And obviously the vaccines get transmitted through humans, but that doesn't always get reflected. And human behavior is so dynamic. So yes, we can talk about what the research is going on, but I really want to get people to talk about what they're doing in their day-to-day life. What stops you? Because the research is there. There's statistics, hundreds of pages of statistics that can tell you what we're doing in research. But how's that being translated into your behaviors on a day-to-day with your friends, with your loved ones, with the people you hook up with online or in a bar? Does that even matter at the end of the day? Or does it matter that you feel well enough in yourself so when you meet that attractive man in the bar, you're able to negotiate with him and say, you know what, I really like you, you have a great dick, you have a fat ass, but I need to protect myself. So we're going to use a condom.
Or a great dick and a fat ass. You could have both.
Oh, yeah. That's rare, but...
I love our show.
I'm sorry. The two are not mutually exclusive.
It's just rare.
And you can find it.
I mean, I've seen a lot of boys. Anyway, let's back that up.
I just torpedoed that. I'm sorry.
So as far as research, we touched on this a little bit for the people who came in late. So we know PrEP works. It's been around for some years now. We're actually doing an experimental drug called cabotegravir. And in preliminary research that's been done in animals and research that's been done from before this phase 3 research shows that there's a likelihood that can be as good as preventing HIV than as Truvada is. And that will be in an injection form. So right now we're just kind of trialing it out, and it's a worldwide research study that we have close to 3,000 people who are in the study right now across the world. And it's a drug that's injected every 8 weeks. It's called cabotegravir. So if that works, that's really exciting because it's moving the needle even further away and closer to actually having more preventative methods for HIV. So I know for some people, a pill a day doesn't actually work.
And they don't like taking pills.
They don't like taking pills. It's too much to remember. If you're only having sex once a month, why am I taking this pill every single day? But if you have an injection, some people don't mind injections. You do it once every 2 months. you forget about it until next time. So I think that's a very exciting place that we're going. We also have other research where we're looking at the mucosal. So we do a lot of rectal sampling, so kind of seeing how the rectal mucosa impacts HIV, and we're kind of looking at different age groups. So we're doing 18 to 24, we're doing 24 to 35, and then we're doing over 50s, just to kind of see if the rectal mucosa changes over time. Does trauma impact HIV transmission, or does a nice, fresh, newly formed rectum, is the best way for HIV to kind of come into the system. So there's lots of exciting research.
You want to give them the layperson's definition of mucosa?
Yeah.
What's mucosa? For those of you that don't know.
For those of you who don't know what mucosa is, it's the soft tissue surrounding the rectum. We also have it in our mouths, and we also have it in vaginas for those of us.
So if people think about rosebuds,
Right.
right? And so that's the tissue.
Right.
That's the mucosa from the inside
that's
that
what-
pushes out a little bit.
Right.
That's it. I know, and Alvin's thinking this is way too much.
Yes.
for this
I
right
love
now.
the
No, this
rosebud
is-
idea. I never used that.
But the
before.
rosebud, but that's like the because you
good.
know it's pink on the inside, and that's what people say all the
It's
time.
pink and rosy.
We're all pink on the inside. That's the mucosa. That's
Right.
that tissue
Got
on the
it.
inside of the
I
rectum.
didn't know
There you
that.
go.
The other thing I would add to that, I know we're going to wrap it up. Alvin just told us to wrap it
Yeah.
up. But the injectable stuff is coming. We are looking because, especially with bottoms and preparing for anal sex, douching is a big
Right.
thing. So we're looking at like enemas and douches that have HIV
Wow.
medications in them. And also I think there are studies with some antibacterials
Yeah.
that they could use to prevent against that. So women can use that. There are also implantable devices. Similar to like Norplant, like or
Yeah.
like the
Wow.
contraceptives.
Contraception for women.
Yeah, that you would use like every 3 months. Also, transdermal patches. All these things are like some of them
the
are in early
pipeline.
stages.
Yeah. I think the gel is
gel is-
closer to kind of being on the market than some other things that David mentioned.
Yeah, and I think people are excited about the gel because
Yeah.
a microbicide gel or that has like HIV medication in it. Women can use it on the vagina, and you can use it before sex or on a daily
Right.
basis. And men or women can use it in the anal area when they're
Excellent.
engaging in
Or
anal
on your
sex,
penis.
or on your penis.
Yeah.
And you can do that. So all these things they're like really exciting because it's not a one size fits
Right.
all thing.
And it also gets you to incorporate something you're already doing anyways, because most people use lubrication.
Right.
So if you have a lube that's also medicated with
That's
antiretrovirals that can prevent HIV,
That's
then
amazing.
you use one thing and you're done. So,
Right.
Yeah.
but
It's
you
a
can always
twofer.
reach us. I'm happy to answer any questions online.
Yeah,
On
what's a good
Instagram.
way they can-
A good way is Instagram. I'm
Okay.
always
Yes.
on Instagram.
So we do have your Instagram
you have it up?
name
Oh,
that
great.
we've been
So I
putting
don't have
up.
to say
So
that.
yeah, so make sure, and we'll also include it in the description as
Yeah,
well.
that's fine.
So like I want to thank. There's been such amazing interaction. Thank you both for your
Yeah.
expertise and the work that you do. So several
He's amazing.
things. Make sure you hit the thumbs up button, and if you haven't hit subscribe, make sure you hit the subscribe button. You can follow us online on Facebook at The Counter Narrative, on Instagram at, on Facebook at The Counter Narrative Project, on Instagram at The Counter Narrative, and Twitter at Building Desire.
Can I do one quick shout out?
Of course.
I apologize,
go
Alvin.
ahead.
I'm very sorry.
No.
So Michelle brought up a very good point, which was as Black men, we need to go to see providers and take care of our health and be empowered. There's a wonderful article written by George Johnson. Shout out to George Johnson. It's on Mike.com. It's called An Open Letter to Black Men
Yes.
of Going to See the Doctor. And he actually interviewed me for it a while ago, and I forgot that he was putting it out. But the article is wonderful because it acknowledges how messed up the medical profession is to us as Black men, but then also says we need to take care of ourselves in spite of that. And so I haven't seen many articles do that. So George, kudos to you, and
Yes,
thank you for
absolutely.
writing that article. So if you go, look up George Johnson. He's on social media everywhere,
Mike.com.
and it's also on Mike.com, MIC.com, and check him out. It's a beautiful, beautiful article.
Perfect, and we'll make sure that we go ahead and add that into the
Perfect.
comment as
Yeah,
well.
perfect.
So I want to thank everyone for joining us this evening. We will be back at the end of the month, so we will be off for the next couple of weeks, but you can certainly find us on Facebook. In fact, next Thursday, on Facebook during the day. This is this is new. We're trying something new.
Cool.
We're actually going to be having a really amazing conversation with Anthony Antoine. It's called For Better or Worse. You can look it up on Facebook. We are going to go live on Facebook and have this conversation with him about marriage and love and loss and legacy,
absolutely.
where he's going to honor the legacy of his husband, Michael Smith. So join us on Facebook next Thursday at 3 p.m. The event is out there. We want to thank all of you for joining us here on YouTube. We will see you at the end of the month. We're going to be talking to Michael Gibson. Counter Narrative Project is releasing a conversation guide, which specifically is a conversation guide for Black gay men and crystal meth. We're going to be talking about that within our community, and Michael's going to be on the show talking with us about it. So we'll see you then. We'll see you on Facebook. In the meantime, thank you so much for joining us. Thank you all so
Thank you
much.
so much.
You're welcome. Have a good one, everybody.
Bye.
Bye, y'all.
Thank you.